For our project, we will be discussing Michelle Obama's leadership style and her Let's Move campaign. We will include how it was successful, some of its pitfalls, and how it could be improved. Our team name is Healthy Humans, and the members include Kristen, Olivia, Elizabeth, and Camille.
Michelle Obama is a visionary leader. She forms bonds and builds trust through excellent communication and inspiration, which helps drive change and progress her vision. Some characteristics include self-respect and respect for others. Michelle Obama has confidence and carries herself well. With this demeanor, she draws others to respect her and what she has to say. She also listens to others' opinions and takes them into consideration when making decisions. She's relatable to employees. She shares her life stories with those around her and is able to relate to other women, especially African American women, who have also fought to break down barriers. By being transparent, you can not only build trust and rapport with your employees, but also form relationships and facilitate better teamwork. She is an effective communicator. Michelle was confident and passionate, which drew people to her. As an effective communicator, you must be open to suggestions and ideas so you can consider other points of view and let people know you are here for them and not just yourself. She's honest and dedicated. She has been open about her struggles and where she has been wrong, and this transparency is important in leadership in order to earn respect from others. Leaders aren't all-knowing. They make mistakes and aren't perfect, and employees need to know these facts in addition to all the great things their leaders do. She's inspiring and motivational. If you think about someone you look up to and respect, there's at least one aspect about them that inspires you. Each leader is different, but every good leader is able to lift their employees up and motivate them to work toward the goal. Michelle Obama inspires others through her story of perseverance. Her father was diagnosed with multiple sclerosis when she was young, but she didn't let that bring her down. She performed well in school, graduated from Harvard Law School, and has continued to be an incredible professional working in public service, as well as mother, wife, and has empowered women throughout her professional career. While she has had some pitfalls, she also has risen above challenges and helped improve the health of countless individuals in the United States.
Michelle Obama, a former First Lady of the United States of America, created the Let's Move campaign on February 9, 2010. Her goal was to increase physical fitness among youth and make healthier foods available in schools. It was launched in an attempt to combat the obesity crisis in the U.S. 1 in 3 children in the U.S. are overweight or obese, and if the trend were to continue to rise, 1/3 of children born after 2000 would suffer from diabetes and have a higher risk of high blood pressure, cancer, and heart disease. The rise in obesity is due to the increased portion sizes of foods, the types of foods offered, and the lack of physical activity among children today. Instead of eating fresh, home-cooked meals, kids are eating fast food and snacking throughout the day. And instead of playing outside, they're stuck in front of TVs or on their phones. Michelle's campaign serves to change this lifestyle and revert to a healthier time when families ate homemade foods together and children played for hours outside after school. Michelle lobbied for the nutrition standards in public schools to be raised, and in 2012, changes went into effect that called for more vegetables, fruits, and whole grains in school meals, along with less fat, sugar, and sodium. More than 90% of public schools in the U.S. have met these new standards since the initiative was enacted. Other elements of the program included Chefs Move to Schools, which was a program where chefs were matched with schools to assist them in learning how to prepare healthy foods. In addition, there was guidelines provided to the schools to promote physical activity through PE programs.
Former First Lady Michelle Obama's goal was to encourage children to live a healthier lifestyle. Through her hard work and dedication, Michelle Obama was able to reach many children across the country. School meal nutrition standards were updated for the first time in 15 years. There was an increased funding for the first time in 30 years and an increased access to fruits and vegetables to students. This campaign incorporated different ways to promote healthy lifestyles, such as increased opportunities for physical activity and participation from other companies and campaigns to encourage Americans to consume more fruits and vegetables and drink more water. Only 8% of 2 to 5-year-olds were obese in 2012, down from 14% in 2004. This access to healthier food was aided by the Food Environment Atlas tool from the USDA. Although Michelle Obama did have a small impact on childhood obesity, her campaign was not flawless. Instead of hiring a registered dietitian, Michelle Obama hired a family friend to be the director of nutrition policy for the White House. He had no previous experience in nutrition and was an assistant chef before working for the White House. Piles of paperwork were thrown onto daycare centers to set nutrition goals, yet there were no follow-up evaluations to see if they were meeting their goals. The School Nutrition Association is now pushing back against the standards, saying that less lunches are being sold because children don't want to buy the healthier lunches. This in turn hurts the food industry that supplies the ingredients to make school lunches. Some politicians believed that the change came on too quickly and that schools would need time to adjust. As a result, an Alabama Republican drafted a bill that would give schools 1 more year to skip the nutrition requirements. Since the Let's Move initiative was a collaboration of many government agencies and private entities, it lacked full-time employees. Department heads, business executives, volunteers, teachers, legislators, and others had to carry out the mission and goals of Let's Move in conjunction with their primary work obligations. Michelle Obama is the chief spokeswoman and promoter, but she did not have the staff solely dedicated to carrying out the Let's Move initiative.
Based on the previous advantages and pitfalls of this project, there are some lessons learned that can be reflected on in order to reduce the amount of pitfalls if this project were to be implemented again in the future. One of the first recommendations for this project would be to hire a professional dietitian who knows how certain foods can affect the body and what other lifestyle aspects can change one's health. In such a position, when wanting to create a nationwide plan, it is important to use the best resources available. This can even be seen in a hospital or smaller settings, because not using the correct knowledge and resources could prevent success for the project. Having a profession with the correct nutritional schooling background would ensure that the foods being served are best for the specific school-age children. Children require different foods of specific nutritional value when at different ages. A high school student might not require the same food as a first grader, so it is important for a dietitian to know which food options are best for them and should be implemented in their school lunches. Another recommendation is about the continuation of the project. When researching this campaign website, there is a note at the top indicating this project is frozen in time and is historical material. When organizing this project, there was no set future plan to be continued in other terms of office. After Barack Obama left office, there was no organization of the Trump administration to continue the campaign. In order for this project to be successful, it needs to have definite certainty of its movement in order to be successful in a certain amount of years. Although different presidential administrations have different plans during their terms of office, if a previous First Lady prioritized her own projects to be taken over by the next, then there could be possible continuation of the Let's Move campaign. Using incremental steps when planning and implementing a large-scale project can help with its success because the project will be thought out in terms of the impact and possible reactions from others as well as possible downfalls. In congruence with the previous recommendation, instead of trying to implement the campaign in just Obama's term of office, being able to set a timeline but not to rush the implementation could have led to greater success. Using the crawl, walk, run method would allow for the leader to see the bigger picture of the project and execute it while using necessary resources to make it successful. This would have needed to take time, and possibly more than Barack Obama's term would have allowed. Steps such as the planning of the project directors, such as the dietitian or nutritionist, as well as other educational leaders, the discussion of the best foods for specific age groups and other demographics, and a possible testing of school lunches would have taken time. But this could have led to a trial and error process, and further leading to possible success of the campaign as a whole. Lastly, those who will be actually consuming the food should have a say in what they want to eat. Although it would be a process to send a survey to students among all grades and at schools of different demographics, having information from the students would lead to lunches they enjoy. The choices on the survey would need to be healthier options, but when compliant with the school zone and county, the students would have more of a say in what they want to see and what they enjoy in their school lunches. Giving some power to the students would lead to unity among the cafeteria, students, and all of those who helped implement the Let's Move campaign, because there would be less negative feedback about the food. The voices of the students are the biggest asset when looking to implement a project for them, so their opinions matter the most in what healthy options should be served for their school lunch.